How dangerous are cardiovascular diseases? So when we talk about heart disease, most people imagine an older man clutching his chest in pain, and these all photos in internet or movies. But the truth is, cardiovascular disease or CVDs are far more dangerous and widespread than most of us realize. Every year, 20 million people around the world die from cardiovascular disease due to this condition. That's almost 1/3 of all global death. How dangerous are cardiovascular diseases? Think about that. One out of every three people. And I'm absolutely sure one of your relatives, maybe family members, gone due to this problem. Rest in peace, of course. So, and what's even more alarming, this more than 3/4 of these deaths happen in low middle income countries, places where people often don't even know they are a risk until it's too late. And actually, it's not a question of knowing or not knowing. Patients don't pay attention in these countries, don't spend time for their health, no, I don't talk about money. It's actually, walking is not a question of money. No, it's a question of laziness. Our two big enemies is fear and laziness. So what exactly do we mean by cardiovascular disease? It's not just the heart attacks. It includes strokes, blocked arteries in the legs, congenital heart problems present from birth, and even heart valve damage from infections like, rheumatic fever. In simple words, it's every disease that damages the heart of the blood vessels that feed it. Now, here is the scary part. Most of these diseases develop silently, even from your teenage period, when you eat fast food, smoke, drink, etc. You can feel perfectly fine when your arteries are slowly clogging up with the cholesterol. It's not a question of eating cholesterol. No, cholesterol is a sign of inflammation. The one day a small blockage becomes a heart attack or stroke. That's why doctors often call it silent killer. But here is the hopeful part. Most heart diseases are preventable, of course. Smoking, poor diet, physical inactivity, obesity, excessive alcohol, and air pollution, these are the main triggers. And the good news, you can control every single one of them. At eating real food instead of processed, staying regular physical activity, quitting smoking, managing stress, and getting regular checkups, you can reduce your risk dramatically, often by more than half.